Hi, my name is Marissa Gelbar. I got spinal fusion back surgery in 2014 to correct a 107-degree curve corrected by Dr. Peter Newton. Today we're here with Dr. Cahill.
Hey Marissa, thanks for having me. I'm Patrick Cahill. I'm from the Children's Hospital of Philadelphia, and I'm excited to talk about some of the research we've done through the HARM study group and the Setting Scoliosis Straight Foundation.
Thank you so much for coming. Can you tell us a little bit about the abstract you presented last year on can a threshold curve magnitude be identified as a surgical indication in cerebral palsy scoliosis?
Yeah, I'd love to talk about that abstract. So the question we had in our mind is, looking at an x-ray of a child with cerebral palsy and scoliosis, is there a measurement of how bad the scoliosis is that tells us when we should definitely do surgery? So other forms of scoliosis, like adolescent idiopathic scoliosis, there are clear delineations, usually about 50 degrees, where people think it's time to think about doing a fusion surgery. With cerebral palsy type scoliosis, it's not as clear. So the way we went about answering that question is we looked at the data from the HARM study group, and this is a multi-center registry of hundreds of patients with cerebral palsy and scoliosis that have had a spinal fusion. And we tried to figure out what all of our peers and what are the other doctors in the study group doing. So we tried to figure out what size Cobb angle, which is the measurement of scoliosis, what size Cobb angle they were doing their surgery on these patients at, as a way to try to figure out, is this what we should be doing? Is there a consistent number beyond which patients are starting to have surgery? And ultimately the answer was that there's not really a consistent Cobb angle. There's some centers that try to take care of the curve when it's relatively small. There's other centers that wait till the curve gets bigger. And all of those centers seem to have success in terms of health-related quality of life outcomes and complication rates and things like that.
Great. So how do you think the results from that investigation might improve care for patients with scoliosis?
I think it's going to help physicians in discussing treatment options with families in saying that, yes, while the scoliosis is present and may need a surgery, the timing can be more related to other factors going on in that patient's life, whether it's health issues or social issues with the family, and that the need for the surgery can be tailored around those other factors rather than specifically looking mostly at the x-ray and the size of the curvature.
Great. Thank you so much for coming, Dr. Cahill, all the way from Philadelphia. We really appreciate it.
It's been my pleasure. Thanks a lot.